Lesson number 19, Narrow Network Health Plans. Hi, it's Mike. How are you doing today? I hope you're doing well. Thank you for coming by. It's good to see you again. Narrow network health plans, or narrow network plans, have grown in popularity, just like defined contribution plans and high deductible health plans. Narrow network plans have grown as a result of the Affordable Care Act's insurance exchanges. The mechanism that's causing this growth really is that many of these plans have cheaper premiums, and the cheaper premiums are very appealing to people who are shopping for health insurance by price. Now, we've discussed a number of times in previous lessons how dangerous these plans can actually be. Narrow network plans fit right along into this dangerous scenario. Narrow network plans are basically, at the core of their being, plans where a small number of healthcare providers and facilities come together out of a large group. These people provide your healthcare services. They do not pay for out-of-network services or procedures. Everything must be done in-network. Everything must be done in-network. Narrow network plans have a lot of problems built into them. One is access. Many doctors who are considered higher tier, or facilities that are considered higher tier, are usually not included in these plans because the insurer said they cost too much. Be aware of that when you go to look for a healthcare plan. The term narrow network health plan or narrow network plan, you won't see written much. You won't see it. You'll see it in articles on the internet. You'll see it, I'll talk about it, but overall you don't see that term used. You don't see either term used. But understand, with a narrow network plan, yes, you will get a better deal financially as far as your insurance premium goes. But understand, access will be limited. Understand, out-of-network care will not be paid for. Understand that. Provider directories are usually out of date and or inconsistently updated. Be advised, you think Dr. Smith might be part of it, but then again, you find out that he or she is not. So if you find yourself in one of these plans, make sure that you contact the provider to see if the doctor you want is actually participating with the plan. We've talked about this in previous lessons, and if you have any questions about that, you can always review our previous lessons and go over that material again. With narrow network plans, there is also a building dissatisfaction among patients with these plans because of the things I just mentioned to you. In addition, you can be hit with surprise bills. People that you go to see can be out of network. So if you have one of these narrow network plans, please be careful. Check everyone out with the provider to see if they actually participate. Sometimes even the providers don't have the correct listings, but call them anyway and see what they have, and see if your provider, your laboratory, your hospital, whatever, participates with the plan. Narrow network plans are not forgiving. They do not forgive transgressions. Be advised. Another problem with narrow network plans is that if you live in a rural area or an area that is outside of the suburbs of a major metropolitan area, there may be no providers or facilities available to you. Once again, you have to go and find out who participates in your plan and how far away this person is from where you work or where you live, whatever. Please do your due diligence and research everything with these plans. Leave nothing to chance. Narrow network plans can be extremely dangerous, so make sure you do your homework first before you sign up with one of these plans. Please remember, do your due diligence. I can't say it enough. I could say it a million times and still couldn't say it enough. Do your due diligence and be very careful with these plans. Know your PCP, know your specialists, know your labs, know your providers. That's the best defense you have with these plans. That concludes what I have to say in this lesson. If you like what you've heard so far, please subscribe, like, and comment. Thank you for your time. Take care and be well.